COVID cases among young children are almost doubling in some parts of Texas. Good evening. Thanks for joining us here at 11:37. I'm Robert Hadlock.
And I'm Britt Marino. Some pediatricians tell us their hospitals are near or at capacity. One baby infected with COVID was airlifted to a hospital about 170 miles away because there wasn't enough space in the Houston area. KXAN's Jennifer Sanders takes a closer look at what we are seeing in our area and across the state.
She's doing much better. She's off the breathing machine right now. She's stable, and I saw her about 2 hours ago. She's resting in her mother's arms comfortably.
11-month-old Ava Ramirez started her journey from Houston to Baylor Scott and White McLean Children's Medical Center in Temple about 24 hours ago. This after being diagnosed with COVID-19 and airlifted because there were no available beds at major pediatric hospitals in her area.
Certainly scary for her parents. She arrived at a hospital in Houston where, because of her condition, they needed to put her on a breathing machine.
Dr. Dominic Lucia is treating Ava. He says hospital capacity is a concern statewide as they see more respiratory illnesses among children.
We've seen all children's hospitals across the state near at capacity, including ourselves.
Community pediatrician Sunaina Suhag went from seeing about 5 to 10 COVID patients a day to more than 20 at Austin Regional Clinic. For kids under 12, she says symptoms may vary.
I'm still seeing milder, cough, congestion symptoms, watery eyes, scratchy throat, that kind of thing. But there are always cases that could fall into that 2% that tend to be more significant.
Travis County is seeing an uptick in cases among children under 10. Data from Austin Public Health shows last Friday there were about 35 new cases in that age group. This Thursday, that number was almost doubled.
In terms of the severity of disease, the portion of those kids who are getting severely ill is still the same, but that number is higher because more kids are sick.
That's why this fall will look a lot different for Erin Hazel and her 21-month-old son.
We decided not to put him in daycare because of the Delta variant. So we're pretty much going back to previous pandemic precautions.
In Austin, Jennifer Sanders, KXAN News.
Doctors stress COVID-19 protocols are still important for families with unvaccinated children, especially ahead of the start of school. We also checked in today with Dell Children's Medical Center to see how many COVID pediatric cases they have and how many beds are available. We'll let you know when we hear back.
Across Texas, more than half of people ages 12 and older are fully vaccinated. But where do vaccination rates stand for the youngest Texans who are eligible? This graph really breaks it down and shows you ages 12 to 15 here. In Texas, nearly 26% are fully vaccinated. But in Travis County, that number is much higher. 42% of children in that age group are fully vaccinated.
Health officials say emergency authorization for COVID vaccines in children under the age of 12 could come this winter. Vaccine studies for that age group are happening right now. Pfizer, which is the only vaccine available for those ages 12 to 15, expects data on children ages 5 to 11 in September. Trial results on toddlers up to age 4 could come soon after that. Moderna's timeline for data on children is likely later this fall or in early winter.